My name is Kristen. I am the Director of Animal Care for the Conway Area Humane Society, the practice manager for the Valley Animal Hospital, and most importantly, I am Abu's mom. Abu ended up at the shelter in 2019. He was transported from Puerto Rico. When I first met Abu, I was an animal caregiver here and I did not have any intention in adopting another dog. But Abu was in pretty rough shape when he arrived. He had teeth that were infected that needed to come out, and he had upper respiratory infection and ear infections. So he needed a foster home, and I ended up taking him home for a temporary foster, and then he never left. Abu has quite the personality. He's definitely a bossy little guy who likes to be in charge, but he is very sweet and he's very goofy, and he likes to get the zoomies and play with his dog sibling, and he does bark at the cat sometimes, but he does tolerate them and will cuddle with them. He's a very smart dog and a very sweet dog, and I absolutely love him. He's a great pet. I noticed shortly after Thanksgiving that Abu didn't quite seem himself. He seemed a little bit more lethargic, didn't want to spend time with us, and a little uncomfortable. So we brought him in to see Dr. Leo to see if there was anything behind that. He was getting older, so we weren't sure if he was just slowing down in age or if there's something more serious going on.
Abu presented to Valley Animal Hospital for hind end weakness, lethargy, and anorexia. He hadn't been himself for a few days at home, and so we did a physical exam. And based on the physical exam, it was decided that the next course of action would be x-rays. The x-rays revealed some free fluid in the abdomen and what was concerning for a splenic mass.
Dr. Leo and I had to work together for about a month with different diagnostics and monitoring Abu's behaviors and how he was doing to actually get to the bottom of what was going on with him. He hid his symptoms and what was actually going on really well. And it wasn't until we did follow-up x-rays about a month after his original decline that we ended up finding the mass on his spleen.
Commonly, in older dogs, hemangiosarcoma represents about 2/3 of the cases. Hemangiosarcoma is a neoplastic process or cancer and unfortunately has a poor prognosis. However, in Abu's case, it turned out to actually be a benign mass, and therefore his life expectancy is greatly improved.
Once we found out that Abu had a mass on his spleen and we knew that we were pretty limited in the options to treat it and that he needed surgery, I got really nervous. It's a big surgery and he's a dog that I've had for over 6 years now, so I was very attached, and it was, as a pet owner, nerve-wracking to send him into a big surgery like that. Recovery was a little rough for Abu. I think that part of that was his age. Part of it was how big the surgery was and removing an entire organ from him. He took about a month or two to really bounce back and get onto his feet. But since then, he's turned out to be pretty much as he was before surgery. We're now 4 months post his surgery, and Abu is completely back to normal, eating normal, bouncing around, bossing everybody around, including myself again. So the surgery was completely successful and really did play a big part in saving Abu's life.